Alberta is very competitive in Canada when it comes to compensation for physicians. We got some of the best health facilities in the country, and the South Health Campus will be opening in the fall, well, in late summer, and then in stages through the fall and the winter. So, we have some excellent research facilities. There's a lot in Alberta going for us in terms of being competitive. That said, I've also talked about the role that other health professionals can play. Specifically, we've talked about nurse practitioners. We've expanded the role of pharmacists. What I want to see, and I think what Albertans want to see, is every health professional working to the full scope of their training and expertise. And that doesn't just help those professionals, it helps doctors because it frees them up to see more patients and to see patients with more complex needs. So yes, we're going to focus on continuing to recruit doctors, but we have to also do a better job of using those other professionals. Can
I just ask one follow-up question about Carmen Day and your request of AHS? Was that an order similar to the one you gave regarding the food issues? I can't remember the name of that.
A directive?
A directive, yeah. Was it a directive?
So I didn't put it in the form of a directive. I simply called and I said what I had seen and what I had heard. Frankly, how disappointed I am with the way it's been handled, and that it's not acceptable for it to continue to be handled in this way.
Just, there's been a couple of stories in the past month or so, incidents where you've had to intervene in Alberta Health Services. The food one comes to mind, the Morale situation, this situation here, where you've expressed a lot of disappointment about the way that Alberta Health Services is dealing with these high-profile public issues that are obviously garnering a lot of public attention. How would you characterize the relationship right now between your government and AHS and your feelings towards the senior executives there?
Well, I don't think my feelings really come into play. Alberta Health Services is there to deliver healthcare services on behalf of the government of Alberta. So, we can certainly have discussions about either retrospectively about how things could have been better dealt with, or what I would prefer is more prospectively about how to do a better job in the future, and that hasn't been an issue. My primary relationship is actually with the board of Alberta Health Services. Those are the people that we appoint to oversee the delivery of healthcare. And I've said it before and I'll say it again, my ability to answer Albertans' questions and to provide them with assurance is very much dependent on that board and the quality of oversight that they can bring to bear. So I'm looking for more from the board. I'm looking to raise the bar in terms of the oversight role, because I really depend on that.